Hello, I'm Addison Johnson,
And I'm Casey Thompson.
and we will be talking about Graves' disease. A little history about Graves' disease. It began in 1840 with Carl von Basendow, who was the first one to distinguish the disease. But it wasn't until 1835 that general medical aspects came into play by Dubliner Graves, which he is named after, or named the disease. The eye protrusions were further diagnosed in 1786 by Caleb Perry, but it wasn't until 1888 that it became known as a thyroid issue. Thomas Curling in 1850 discovered it and named it hypothyroidism. But the drugs and radiodyne theories weren't established until the 1940s. The immunological cause. It is a malfunction of the body's disease-fighting immune system. The body produces antibodies to one part of the cells in the hormone-producing gland in the neck. The antibody thyrotropin receptor, pituitary hormone TRAB-B, overrides normal regulations. In over 80% of the cases, it's due to hypothyroidism. But some suggestions say that vitamin D deficiency causes an early onset. That is why it's more common in women. At a higher rate of production for the certain antibodies, they're more likely to attack their own thyroid gland. It usually happens with 30 to 50-year-old women. As seen on the picture to the right, CD4 helper T cell secretes interleukin-2 and IFN to the B cell, which produces thanatropin receptor antibodies that have different causes on the human body.
There are different manifestations of Graves' disease. One is an enlarged thyroid, arrhythmia, which is a really fast heart rate, heat intolerance, fatigue, muscle weakness, eye inflammation, which is like the picture on the right. It actually attacks like the muscles around the eyes and causes your eyes to stick out. It looks really gross. There's hand tremors, thyroid eye disease. Your skin can thicken and turn red, usually on the tops of the feet or on the shins, and a thyroid storm can occur. Experts aren't quite sure what causes it, but something causes thyroid stimulating immunoglobulin, TSI, to be overproduced, which attaches to healthy thyroid cells, causing them to overproduce thyroid hormones. Thyroid eye disease, which is like the picture you saw on the previous slide, is caused by this attacking muscles and tissues around the eye. Thyroid storms are when the overreactive thyroid makes the body functions speed up. It can also come as heart disorders or brittle bones. There are several different treatments, the first being beta blockers. These are things such as propranolol or metoprolol, and these are typically come first when people are diagnosed with Graves' disease. They help regulate the heartbeat and protect your heart from other treatments that come later. Anti-thyroid medications block the production of the TSI hormone. These can cause things like skin rashes or low white blood cell counts. Another one is radiation therapy, which can be taken as a pill or liquid over 2 to 3 months. This radiation destroys thyroid gland cells, which can cause the hormone levels to return to normal. Another one is surgery, which is a thyroidectomy, which actually you take out part or all of the thyroid gland, and then you will have to take thyroid replacement hormone medications if you start producing too little of the thyroid hormone after this surgery. People that have Graves' disease, these are just some tips from them. They suggest seeing a doctor regularly. Make sure you always take your medication, like the anti-thyroid medication or the beta blockers. And they also suggest avoiding too much sugar or alcohol, and then completely avoiding gluten.
Other fun information we found was President Bush and his wife Barbara were diagnosed while in office. There's an increased risk of in-pregnancy problems such as miscarriages, preeclampsia, premature labor, and low birth rate. Here are our cited sources. Thank you for listening to our video. Have a great day, Dr. Johnson.